know me would normally start. Where would you start? From a nurse, right? A nurse. But now look at this. What if I was to do a nurse auscultates a loud cardiac murmur with a newborn with suspected trisomy 21, genetic screening, echocardiogram? Yo, that's a lot of information. And they got an exhibit in the corner? That's a lot. How about this? What I learned from my failures was to change my mentality. And what I'm going to do, whether you've failed or this is your first attempt, how about I change your mentality? How many people remember the movie The Matrix? How many people remember that movie? I see some of y'all that are like closer to my age. Welcome to The Matrix. Because now I'm going to show you how to take control of this question or every question. Check this out. Where do we start now? I'll look at this from a different perspective. I start from the end. I start from the bottom. The neonatal's vitals are shown in the exhibit. Okay, so the vitals for a neonate are shown in the exhibit. Cool. What would be an appropriate action for the nurse to complete next? So now I put this in my own words. I've got a neonate's exhibit or their vitals. What am I going to do next? Like, what am I going to do about these vitals? So do I even care about what's happening up here? Because you know what happens when I start here? I heard a loud murmur and suspected trisomy, and I did genetic screening, echocardiogram, and that's scheduled the next day. Do you know how many words are thrown in there to throw me off? You think I did that on purpose? You better believe I did. But the truth of the fact is all I'm looking for is what I'm going to do next based on my exhibit. So now all I know is I got a neonate. Before I even think about a cardiac murmur or trisomy 21 or an echo or genetic screening, yo, I put those there for a reason. I put those there for a reason. Let's look at the exhibit. So now I've got a temperature of 98.6. Wait, am I concerned about that? I'm not worried about that. Heart rate of 146. Am I concerned about that? No. Respirations or a respiratory rate of 42 per minute. Am I concerned about that? No. And O2 sat of 98%. Am I concerned about that? So hold on one second. I just gave you 4 things on your boards to confuse you. I gave you loud cardiac murmur. Whoa, wait, which one was it? Was it pulmonic stenosis? Was it a VSD, an ASD? Do you see where your mind goes? And don't jump ahead. Let's all learn together. But do you see where I'm going with that? As a test maker, right? As a test maker, I'm like, yo, I put in a loud cardiac murmur. I put in trisomy 21, or I put in a genetic screening. I put in echo. Oh my goodness, what is this? What is this? Is this technology flow? Is this was it Kawasaki's? Is this a PDA? I don't know. But did that even come across my head when I started from the bottom? No, because everything was normal. So now I continue with the method. What would be the most appropriate action? What are you going to do? What are you going to do? Do I start with number 4 and do I make a decision? No, and please don't jump ahead. Please don't jump ahead. So do I start with number 4 and make a decision? No, I compare number 4 to number 3. That's all I do. That's it. Because when you're on test day, you're going to look at this and you're like, yo, all right, cool. What am I going to do? Am I going to provide oxygen? 98% oxygen. Okay, cool. Or need a chest? Well, guess what? Dr. Z taught me that need a chest is probably because they're deoxygenated because of tetralogy of flow. So really none of these really stick out to me, but I'd say, let's get rid of oxygen because they're at 98%. I don't know if I got to do need a chest position or not, but right now I know that they got 98% oxygen, so I'm not going to give them oxygen. Then I have a choice between giving them knee to chest position as a newborn with, again, look at the words, suspected trisomy. A genetic screening and echo are scheduled that day. Hold on one second. If they've got a loud cardiac murmur and they're suspected with trisomy 21, what are we going to do? Genetic screening and an echocardiogram. Guess what are already scheduled that day? And is their oxygen affected right now? No, they're 98%. They're 98%. So no. So between the two, I would rather document, because the truth of the fact is, if you came to me and said, yo, Dr. Z, yo, I think that this patient, this newborn patient, may have trisomy 21. Okay. All right. Great job. What are their vitals? Well, they're all normal. Okay. Did you schedule it, or did we schedule a genetic screening and echo? Yeah. Then why are you calling me? Like, why would you call me? Like, yo, just document it. We did everything. Vitals are normal. All right, suspected, not confirmed, suspected. Look at the words. So what are we gonna do? Genetic screening? Okay, cool. Did you do that? Yeah. Do we got an echo? Yeah. Cool. So call me after. Document over anything and then call me. Well, we just had that conversation, didn't we? We just had that conversation. Don't call me until after, because you already did everything. Everything's already done, right? Everything's done. Patient is stable. It's a suspected trisomy 21, because there's multiple trisomies. We've got genetic screening and we've got an echo scheduled that day, right? So again, yes, those of you that jumped ahead of me, I'm so proud that you understand, but let's let everyone catch up. Let's let everyone catch up and understand and see where I think. You may know the answer. That's one thing. If you know the answer, kudos to you. However, thinking like me, guess what I do? I teach the boards. Guess what I want you to do? Think like me. Answering the question is great. So again, nurses, what do you think? Number 2? Are we good with this? Are we good with this? Yeah, I would agree 100%.